Okay, here's my cards. Alright, my name's Julie and I'm going to go over PTSD. So there was a study published back in September from the VA website, and they stated that there was 6,000 veteran suicides per year from 2008 to 2016. And veterans are 1.5 times more likely to commit suicide than non-veterans. And you can also have PTSD in the non-veteran population as well with certain criteria. And I'll go over those in just a second, along with some therapies. So per the DSM-5, which is the diagnostic manual psychiatrists and psychologists use, there has to be a traumatic exposure. So this could be an actual or threatened death, a serious injury, or any sexual violence in one or more of these ways. It can be a witnessed traumatic event. It can be witnessed, a direct exposure, so it happened to yourself. You can learn from it happening to a very close family member or friend, and that has to be an actual violence or accident. There also has to be intrusive thoughts, so you're going to have intrusive memories, flashbacks, nightmares, and this is going to cause a big dysfunction. In kids, you're going to notice a repetitive play. So they're going to repetitively act out this, whatever trauma this was. Another way is with avoidance. So somebody might avoid fireworks, or they might avoid big crowds, or they might avoid men, if it was a woman with any sexual violence. There could be negative cognition, so anger, fear, guilt, irritability, forgetfulness, loss of interest. You're going to also have a change in arousal. So it's going to be an exaggerated startle response, hypervigilance. They're going to just be really jumpy, a really jumpy, anxious person. And this all has to be present more than 1 month in order to get that diagnosis. So now we've gone over some signs of PTSD, and we're going to go over some therapies and treatment options. So treatment as usual is basically medications and CBT. EMDR is an eye movement desensitization, and that is a specialization that the therapist obtains in order to do this. It's a repetitive eye motion that they do along with the therapy. And there's some newer therapies that I'll go over. There's a study in physiotherapy theory and practice in 2017, and it was BBAT, Basic Body Awareness Therapy. So when you're anxious and stressed out, your body goes into a fight or flight response. So the goal of this is to kind of take control of that autonomic response and calm your body down to where it's not so jumpy and ready to fight. And basically, it's a physiotherapist that's going to help this person with body posture, movements, breathing exercises, along with they do a structured type of massage, and the test group did show an improvement in their symptoms. The next study was in military medicine in 2018, and it was 18 veterans from the Iraqi war, and they did some trauma-sensitive yoga. So meaning trauma-sensitive, hands-off approach. They're going to be aware of certain poses and not do them, and also be cognizant of certain health conditions or injuries and kind of taking that into account. So they did 60 minutes of yoga for 6 weeks, and they did notice a reduction of symptoms. The next is from a book by Southwick and Charney, and it was a Iraqi war veteran. He suffered an injury in theater, and so he had a head injury and suffered with seizures, anxiety, agitation, all of that, and basically started drinking, was contemplating suicide, but then changed around and found faith. He studied ministry and basically turned his life around and found a purpose. So that being said, faith and religion play a big role in that stress and anxiety response, and can help kind of calm the chemistry in your brain and calm you down as well. And the next study was in Journal of the American Art Therapy Association in 2016, and it talked about art. So basically, art can express things in ways that you can't in words. With a paintbrush, it can be kind of a distancer. A mediator of sorts. So you can get things out in ways that you can't just talking about it. And people found a reduction in symptoms with that as well. So there was an article in the Washington Post, and it talked about doctors in Britain wanting to prescribe actual social services, art, that type of thing, in efforts to reduce polypharmacy. So instead of another medication, they want to do some of these therapies to help somebody. So in closing, I've gone over some signs and symptoms of PTSD and some therapies. And per the PTSDunited.org, 8% of Americans deal with PTSD. That's the population of Texas. So 24 million Americans. That's a lot of people. And 1 out of 9 women actually get diagnosed with PTSD. So that's twice as many as men get diagnosed. So I hope some of these options help somebody watching this today. Thank you.